Welcome back. Hyperhidrosis is a condition that causes excessive sweating that's not always related to heat or exercise. You may sweat so much that it soaks through your clothes or drip off your hands, and heavy sweating can disrupt your day and of course cause social anxiety and embarrassment. Now, to delve further on this topic of discussion, we are joined by medical doctor, Dr. Sylvia Kapunja. Doctor, good evening and welcome.
Hi Nina, thank you for having me as always.
Thank you for being here. Lovely having you back. Of course, this is a really serious matter that we're talking about. It might seem, very light and easy, but it's not. If you have got a really bad case of hyperhidrosis, it can be really embarrassing.
Yes, it's such a horrible condition to have, and it's so sad that it's underdiagnosed and quite common actually.
Mm-hmm.
And most of the patients, like I see in my practice, are actually female patients who have a psychological impact because of this condition, especially in their working environment.
What causes hyperhidrosis?
So let's just break it down for a bit for the viewers. So hyper in any medical term means above normal or increased. So hydrosis means sweating. So it's an abnormal form of sweating that can just be caused by anything, Usually it's an individualized condition that doesn't have a specific cause. Doesn't mean that, no, it's because you did ABC or you suffer from ABC. It's just abnormal sweat glands that, are overly active, to say the least. So it doesn't have a specific cause, although it can have triggers, yes. However, it doesn't have a specific cause at all.
What would those triggers be? Because I would imagine a condition like this, it doesn't matter what time of the year it is, you'd still have the condition. But what would triggers be? Would summer?
Yes, so weather condition, climate conditions, our spicy foods, intense exercise, stress is also associated with hyperhidrosis in some cases, and all the likes.
Yeah. Let's talk about the most common sweating points, because I mentioned, the sweat dripping from your hands, of course, the underarms. Where else?
Okay, so I've seen a patient who has what we call generalized hyperhidrosis, who had excessive sweating on their back. It would wet their uniform and shirt, and so sad actually. It was a healthcare provider, so she was helping people. However, she was also suffering herself, and it took her many years to realize that what she had was a medical condition. Yeah.
I want to talk about the remedial actions. How do you treat hyperhidrosis, doctor?
Okay, so it depends if it's localized or generalized. Localized means that it's just at one area, at one local area, and generalized it's more than two other areas, like your armpits, back, under the breasts for females, groin, private parts, and so forth. So if it's generalized, we give a systemic agent, a medical peel or something. Let me not confuse the viewers with my medical terms, But if it's localized, we do toxin injections, so where we just paralyze the sweat glands for a short period of time, which is like 8 to 12 months, and then we can repeat the injections twice a year or so, and
So when you paralyze the sweat glands with this injection, are you talking Botox treatment?
100%, 100%. So we talk botulinum toxin, which is Botox, yes, for the layperson. So what we do is we just inject just beneath the skin where the sweat glands are, just to make sure that they are not excessively producing sweat and not making you uncomfortable. So this is the reason this is only effective in localized hyperhidrosis and not in systemic, because if it's systemic, that means it's more than one area, and of course we can't inject your whole body. Exactly, the entire body. So that's why for the generalized, we give you some pills and medications and some deodorants to use as well.
Yeah, because I was going to say, with some people, just using a different deodorant doesn't work. So if you do the Botox treatment on the localized areas and you've got more than one sweaty point, do you then double up with the medication that you mentioned?
Smart girl, yes. I think we do these interviews too often. Now you're becoming, you're going to steal my job, Nina. But well done, yes. Yeah. So that's what we do. That's what we do. In most medical conditions, we try to marry, you know, the treatment options for the patient, depending on the severity of the patient's condition, you know. So if it's horrible and the armpits are the worst, you know, we'll give you the systemic pill, the pill to take, but we'll also treat your armpits and then also give you deodorant. So, you know, we can make a whole cocktail.
Yeah.
You know.
I want to know about the Botox treatment, especially for the underarms. How effective is it and how long does it last? Do I need to come back every 2 weeks, or how long does the treatment last?
So, as I mentioned earlier, it lasts, you know, anything from 3 months, 6 months to 8 months to 12, depending on the response of the patient themselves, and also obviously depending on the injector, the experience the injector has. So it's not a permanent paralyzing, you know, we're not paralyzing your sweat glands permanently, but if there is also a more permanent solution, which is surgical, where they literally go in there, the surgeon strips out the sweat glands and you never ever sweat in your life. But
I want to know the deodorant that you're talking about, because there's a lot on the market, but what would you suggest for somebody that can't afford to go to see a professional but can just get something from the, you know, the racks on the store?
All right. So this is not sponsored or anything, please, because I'm about to say a brand's name. However, there's one quite effective one, which is called Pyrex. It's in a white, you've heard of it. However, the patients are using it wrongly. So what you need to do is you have to use it at night. You must use it at night, and then in the morning you use your normal deodorant. So use it at night, starting with 2 times a week, because it's quite potent. So if you overuse it and you get irritated by it, you know, it causes a burning sensation and all these things. So it's treatment. Just read the steps in the pamphlet inside. I know we never do that, you know, but it says there to be applied at night, start slowly and then progress as your body gets used to it. And it works quite well, especially for mild cases.
Yeah. Fantastic. Well, any final remarks you'd like to leave, you know, for somebody that is suffering from this condition, doctor?
I think it's just for them to know that they are not alone. You're not alone. Seek help. You're not, you know, having a breakdown. You're not exaggerating. And for people who know people that suffer from the condition, please don't make fun of them. It's a serious condition that affects someone's, you know, mental health. People can't wear tight shirts anymore. You know, they cannot wear anything that exposes their armpit. It's debilitating, actually.
Well, doctor, thank you so much for coming here and educating us. It's always lovely having you with us.
Thank you, Nina.
That was Dr. Sylvie Kapunja talking to us about hyperhidrosis. So I've also learned something new this evening.